Good morning, everyone. Hi. Thank you, Chief Acevedo, Chris Burbank. You're the best. Miss Zeunik, thank you guys for being here. Okay, I'll make very fast, brief intros. We have
No slides,
Chief
no
Art
slides.
Acevedo from the Houston Police Department, Chris Burbank, who is a former police chief, but who is now Vice President for Law Enforcement Strategy at the Center for Policing Equity, and Jennifer Zeunik, and am I pronouncing it correctly? Well, great, who is Director of Local Programs for the National Police Foundation. This is the perfect panel to wind down what really has been a wonderful webinar. I don't know if y'all got to hear any at all of what Andy Potter discussed, but that's where we want to be, talking about folks on the front lines. What are the innovations of this moment? What are the challenges of this moment? And we'll take each of you in alphabetical order. Art, you're on first. Thank you.
Well, good afternoon, everybody. Thank you for having me. And I think you said I'm on first. And thank you for all you do there as great partners. You know, this year has been probably the most challenging year in my 34-year career as a police officer and as a police executive. And I can tell you that from not just a organizational health and wellness standpoint, but from a crime fighting standpoint and public safety standpoint and just a mental health standpoint, it's been that kind of year. We have actually lost 3 members of our department to COVID-19, 2 support team members, and recently we lost Senior Police Officer Leal, who succumbed to COVID-19. And I signed letters for every line of duty death, police officer death. And I've signed over 300 letters across the nation for just police. So you can imagine 275,000 people. You want me to talk about when we first started this, we started responding to COVID as an organization with our measures at the beginning of March. We put together robust measures that required people to socially distance in the station, outdoor roll calls and debriefings, gloves, masks, eyewear, disinfecting police cars, hand sanitizer everywhere, including in the police cars, and so on and so forth. And we did just a phenomenal job. And it seemed like it wasn't until the governor reopened the state right when we were going into Memorial Weekend. Up to that point, March to the end of to May, we were doing phenomenal. We just had maybe 3 dozen people that had been exposed. And since that day on, it's gotten a lot worse for us. Our numbers have gone up. And then and we were able to get them back down. But then in the last, I would say 30 to 45 days, we've spiked again like the country. So we've been very much reflective of the country. But I can tell you that I think part of our challenge has been that there's a lot of COVID fatigue across the nation. And I don't think police officers are immune from that. And so we might have started to rest on our laurels and maybe gotten a little sloppy and careless. And so we've had to refocus on making sure people are following the protocols. And to the extent that we've told people we're going to treat the mask and the protocols like not wearing your seatbelt in the police car, it'll be a 2-day suspension if we catch you out there not doing what you're supposed to be doing. So that's just where we're at. And I'll give you some specific numbers as we go move forward with the conversation.
Thank you so much. Chris?
Thank you. It is a pleasure to be with you. And Art, it's good to see you. Art and I actually became police chiefs just a month or so apart from one another. Yeah. He survived a little longer. As you can see, he's still dressed up and I'm looking like this. Needless to say, I'm more comfortable.
Yeah, you're not missing much right about now. Trust me.
One of the things that I think we need to recognize is pandemic was nothing new to police agencies across the nation. I mean, I remember early, prior to the Olympics coming to Salt Lake City, where I was the police chief, we practiced for what about a nationwide what about a worldwide pandemic that could potentially impact the number of officers we have, how we would do things. And so what I've seen across the country, because CPE obviously works with agencies throughout the nation, is you've seen a switch over to what is a protocol that exists in manuals across the country. This is how we're going to do business. And it starts to limit or reduce some of the activities, especially the self-initiated activities that police officers are engaged in. And so Art can certainly speak much better than I can to what's going on as far as police response. But I think where I'd like to focus a little bit is kind of twist it just a bit, because what we've had is not only a pandemic, but we have had a nationwide crisis where we've seen people in the streets, protests going on top of that. And while you look at some of the response that police agencies have had to that, and the stress that that's added to the entire situation with the nation and the conflict with wearing masks and everything else, I think it's the moment to look and say, well, all right, this is what we've been doing for the last 9 months for a pandemic, this focused response to what's going on in our communities, as opposed to a very broad response. And it will be interesting to see, as you look statistically, has crime elevated dramatically? Has it declined? Where has the change in policing changed the outcome of policing? And when we talk about race and the intersection between race and policing, this may be the avenue that we can learn from as we go forward to address the social problem that we have with police agencies throughout the nation. Maybe this is the moment that we look and we learn and we say, boy, this reduced response has changed this. And I think what's so important is the statistical gathering, the data analysis that needs to take place in order to make this should not be a feeling, right? That, you know, Art and I think this is the right thing to do. It should be an avenue that we say, boy, scientifically, this is how we're going to change the outcome. And this is what we've learned from our experiences over the last 9 months, and hopefully a short, fewer months into the future.
Thank you so much. Jennifer?
Yes, hello everyone. Katti, thank you so much for the opportunity to be here today and to talk to you all. I did send some slides. I don't know if you guys can run those, or if you want to share, make it so that I can share my screen.
Sure, Chris should be able to do that for you.
Okay. And I'll try to run through these pretty quickly because I know that we want to leave a lot of time for questions. But there are some statistical pieces in here that I want to be able to provide. So let me see if I can. Oh, you've got them for me. Thank you. Okay, next slide. So just to start off with the National Police Foundation, if you don't know who we are, you should. We've been around for 50 years. We're celebrating our 50th anniversary this year, but we're an independent, nonprofit, nonpartisan, non-member organization. Our mission is to advance policing through innovation and science. And our work is all grounded in rigorous scientific research. That's sort of where our roots are, but we've also moved into providing some technical assistance as well. Next slide, please. So we, much like Mr. Burbank, also work very closely with law enforcement agencies around the country. And some of the things that we've heard in talking with our partners is about the organizational changes that they've had to endeavor to enforcing, to dealing with short staffing, to accessing PPE, to dealing with mis and disinformation about COVID, budget cuts, the gamut there. But more so, I want to talk about the individual officer because I think that's where we're seeing a lot of impact as well. And it tends to be talked about less. Officers are human beings. They're required to go to work. They can't work from home, so they have to be out in a community, but they do have the same fears and stress as other people do. And in many cases, they're engaging with a community that's scared and frustrated. And when we add on the George Floyd murder and the reactions that caused, that makes it even more challenging for them. And then they're also dealing with family members and people that they care about who are, in danger, maybe have some sort of compromised immune system or other things that they need to make sure that they keep them safe from. So all of those, I think, as well as vicarious trauma and just sort of balancing it all, I think we have to keep in mind their need for care, self-care, care from their organization, care from the community in keeping them well and able to do their job. Next slide. So here's a little bit, some statistics on some of the changes. This is all data from the IACP CRITAC program with the Center for Evidence-Based Crime Policy at George Mason did through a survey. And they did 2 waves. They did one in March and one in June. And so you can see some of the changes sort of nationwide about what was happening, the innovations that happened, and the way that the police field adapted with regard to responding to calls for service, to making arrests, to having contacts with individuals, a lot of changes in how they operated, changes in staffing and how they work. The one with regard to the communication with the community, I thought was really interesting. 72% used virtual response to calls for service, and also increased their use of social media in an effort to communicate information to the field. Next slide. I know I'm going through these fast, but I just want to sort of set the stage a little bit. So from a police foundation perspective and talking sort of from a law enforcement nonprofit, we serve to fill the gap as much as we can in a civil society. And so here's where we sort of stepped up and tried to provide some information for the field, so resources and some of the data collection that Mr. Burbank was talking about, being able to provide as much information to the field as we could. So put some briefings on a resource page. We were able to partner with some organizations to make PPE available and fundraise to make PPE available, but basically just to be responsive to what we were hearing from the field and to create programs that could fill those gaps. Next slide. We still have some of those programs going on. Our resource page is still up. We did put together a situational awareness dashboard. This was our effort at data collection and providing information back to the field. It was a real-time effort to look at PPE needs across the country and law enforcement agencies, as well as staffing levels and the impact of COVID on their staff. On law enforcement agency staffing. So how many officers had been exposed, how many were out, what are the are there shortages in staffing in agencies and that sort of thing. So we had that going on starting in March, and agencies could sort of watch it and see what the trends were across the country. We're still doing some crime analysis, looking at crime trends and the changes in crime trends through COVID. So we looked at officer line of duty deaths, vehicle crashes and changes in vehicle roadway safety. And we're currently looking at domestic violence numbers and the changes in those. And then we also started a grant relief program for first responders. Next slide, please. This was in response to the needs that we were seeing, personal needs for officers in the field. And it's a micro grant program that officers or civilian staff from public safety agencies can get up to $1,000 to help with their personal issues. Officers that we talked to were concerned about decontamination. Some of them were needing to stay in hotels to keep their families safe. Some of them were wanting to see additional mental health services and needed assistance with paying for that. Childcare was a huge issue, is still a huge issue for officers that are working long shifts, more shifts, and have children who are home remote working. Next slide. And so these are just some impact statements, but you can see there at the chart what the funds have gone for. The majority has been for dependent care, as well as mental health assistance and some of the other categories there that we have. Next slide. So lessons learned, I think, basically, and I think Chief Acevedo and Mr. Burbank have hit on some of these, but law enforcement's incredibly resilient. They sort of made the changes necessary and continued in the areas where they felt service was necessary. I think one example in Miami, we heard about homeless operations out of Miami Police Department. Also LAPD, I think, did something similar where they had to suspend operations for a while, but then just really sort of revamped their program so that they could continue to provide services needed to the homeless encampments. They took masks out, provided ways for education to be given even in the midst of a pandemic. So they were able to be innovative, to think outside the box and continue those service pieces that they know were so important to the community. And then collecting data, as we mentioned, that was one area that we tried to assist with, but that seems a challenge when you're in the middle of a crisis to be collecting data, but I know some agencies, Baltimore Police Department pops into my mind as one that created a dashboard in an effort to keep their command staff and their precincts aware and knowledgeable about people that were, or staff that was out due to COVID. And so they could make some predictions on trends about staffing, making sure that they had enough staffing in the areas where they may need more bodies in places like grocery stores and other locations. And then communication, I think, and partnerships are huge, but communication both externally to the community as well as internally. I know that there was a lot of effort to make sure that officers were provided as much information as possible, the protocols and those sorts of things, as well as increasing different strategies for communicating and providing accurate communication to the field. So, and then finally, I'll just add, politics has no place in a pandemic. I think, that piece just really added a level of stress along with the George Floyd incident that, continues to make policing during a pandemic even more challenging in, wearing masks or not wearing masks, and then law enforcement agencies needing to respond to that in one way or another. So that's all I've got. So hopefully there will be some questions that we can come back to some of this.
Sure. Thank you so much. And yes, there are a ton of questions, and I want to sort of combine my question with my initial question with one from Aaron Morrison from the Associated Press. And so his question is to Chief Acevedo, but I think all of you can answer it on some level. Would you talk specifically about how you've navigated setting pandemic policing priorities and enforcing rules like mask wearing, social distancing, business restrictions, et cetera? Did you, for instance, take specific measures to reduce the number of people cycling into the jail lockup during the pandemic? And that question really is for everybody. What sort of are the arrest priorities at this moment? You're muted. Art, you're muted.
Some people do it remotely, so I got to do my own. Okay, thank you. Ms. Gray. So
You can call me Katti. I'm on, please, since I did first name with y'all, Katti, please.
All right, Katti. So we have by design tried to focus our efforts in terms of enforcement, even before the pandemic, as in trying to look for bad actors and violent criminals, especially in a world of limited resources. And we've enacted misdemeanor bail reform here, so the low-level misdemeanors don't get booked, don't stay in jail. Even when you book them, they go out personal bonds. So having said that, we've tried to limit the number of people that go to jail to people that are actually pose a public safety threat, violent criminals. And that's been by design, especially during the pandemic. So we've instituted cite and release that since this all started, and we were going that direction anyway. We are doing warrants to deal with the cases later. So we have greatly reduced the jail population here in Harris County by design. As it relates to
before you go on, do you have data on how much reduction?
Yeah, I think that it's probably been reduced by. I can have to get an update because I use data. It's in my head, then I go to the next data point for the day. But it's gone down by thousands in the last year and since bail reform, misdemeanor bail reform. But we're also our enforcement posture relates to the mask requirements. Think about the backdrop we've been facing. We're at a time we're trying to build trust with the communities, and poor communities have a harder time than affluent communities getting masks and actually trying to even comply with some of these requirements. So we've tried to use not using the carrot approach, that we look for voluntary compliance almost exclusively. In terms of citing somebody, the governor's order requires you to warn first, then cite. So somebody would have to basically tell you to pound sand to get a citation. And consequently, I think we've issued like a handful of citations. Then the other thing, because of police legitimacy, I talked to the mayor. Mayor Turner was kind enough to make the occupancy rules have the fire department, got a lot of time on their hands, how the fire department has been taking, everybody loves a firefighter, right? People only like cops when they need us. So we were fortunate that our mayor saw that it was a good proposal to actually have the fire department deal with the occupancy rules in businesses, and we only come in if they need backup for any particular reason. And it seems to have worked. Most Houstonians, we're a very special community where most people get it, and we really haven't had to arrest anybody, and I've cited very, very few people.
Jennifer and Chris, do y'all want to weigh in?
Yeah, I do have a little bit of data. I don't know how much it decreased. It decreased the amount of arrests, but with the 2 waves of studies that were done, 76% of agencies that responded had provided officers with formal guidance to reduce their use of physical arrests on minor offenses, and that was in March. Similarly, 72% answered that in June. And then 65% of agencies noted that jail or correctional facilities that intake agency arrestees had already restricted the types of arrestees it would receive because of COVID-19. So that was 65% in March, and then in June, 73%. So there was a high number of agencies that were, reducing their physical arrests and reducing the amount of people moving into correctional facilities.
How many agencies report to you of how many are on your whole sort of in your portfolio, and how many have actually responded to this data collection during COVID?
So to be clear, this was not my study. We are part of a group that works with IACP, and it's called CRITAC. And this study was done by IACP and Cynthia Lum at George Mason University. Cynthia is on our the Police Foundation board, and so that's sort of our link there. But there was about 1,000 agencies that responded to the both waves of the survey.
Out of a universe of how many agencies, and maybe we should go to her, the sort of rural, urban, small town, big city divide? Do you have any sense?
Yeah, I don't have many demographics on that, but there are about 18,000 agencies around the country. I will say that includes federal, state, and local law enforcement. So can't all attribute that to local law enforcement agencies, but.
Sure. Chris?
So the only thing that I would add is we have made the mistake historically as a profession to jump in and take any project or any problem that comes along, right? And this Art spoke very well to, hey, this mask problem is probably not our deal. And oh, by the way, the housing issue, probably not best done by police officers. And so in the past 30, 40 years, all that has come to law enforcement and we've said, oh yeah, we'll take that on. We have a ready force. We'll take on any issue. And that has created some of the discrepancies and the problems and issues that we face today. And so good, reasonable approaches of how can we redesign this? And when you talk about all the rhetoric around defunding and, you know, reorganizing and everything else, what has been described is actually doing just that. You're reprioritizing this resource that we call law enforcement or policing and putting them towards the issues or problems that they are best suited to solve, not every single societal problem that comes along. And so, again, I applaud people like Art because we have seen spots in the country that have gone just the opposite and where they're handing out lots of citations and creating conflict as opposed to trying to reduce that.
We're going to move on to a question from Tom McMorrow, who is a freelancer. This is for Chief Acevedo and Chris Burbank and all. This is the combination of COVID-19 followed by the explosion of the Black Lives Matter movement has, in Tom's interaction with rank and file police officers in the departments he covers, brought about what is an all-time low in morale. Officers feel they're being targeted both spiritually and literally. What is your view of that, and how do communities move forward from that? Art?
Well, this is Art. I think that, you know, it's been a challenging year, but we try to lead with the mindset that challenges bring opportunities, opportunities for organizations, individuals, units, for all of us to do better. And I think for our department, you know, morale, you know, it's probably not the highest because it's not just about the pandemic. It's not just about social unrest. You know, it's about, you know, fear of, you know, catching the disease yourself. It's about the impact it's having on our own families, our extended families that have lost jobs, that have, you know, that have been sick, fallen ill. So it's been a year where I think there's a lot of fatigue across the entire nation, inside and outside of law enforcement. If you look at the impact that COVID, which I think I've always said is a three-pronged threat to the society. It's the public health threat posed by the actual virus. Then you've got the economic impact of our response to try to contain the virus. And then you've got the impact of the economic impact on the psyche, on the family, of people losing their jobs, of people who stuck together. And I can just, the lack of economic opportunity, where it, you know, we don't live on an island as police officers. We are feeling the same impact that everyone else is. And again, it's not just impacting us professionally, it's impacting us personally on a personal level. But having said that, we take the time to recognize that the feelings that we're having as members of the first response community are no different, and the challenges are no different. And in some ways, we're blessed that we are fully employed and gainfully employed, and that while our spouse may have lost his or her job, imagine the families where they both have lost their jobs. Only one was working and now they've lost their jobs. And so I think it's a time in our country for leadership and for making sure that we provide context. And I think as we have those discussions, and in this city, it's a minority majority city, most diverse big city in the country. When we had the protest, I would not trade the job that our men and women did in managing both lawful protest activity and unlawful, because there were some knuckleheads, like there is in any social movement or any movement, I would not trade the way we responded, nor would I trade the way our community conducted itself during the pandemic. And I got to tell you that because of the experience we had with the George Floyd protests here, I can't tell you how many officers have come up to me and other executives expressing great relief and pride in the way that the community and the police department navigated this past summer together. And so I don't think I'm in the best position to answer that, because we actually have been in a better position because of the relationship leading into the summer, and the pandemic was better than in a lot of other communities. And so I think that would be all I have to say on that.
So we often forget policing is just this microcosm of society. The racism, the bias, the fear, struggles with jobs, everything else that exist in society exist within our police departments and are not exclusive to our police departments. The bias that we see within policing is just the result of society putting in place a system that says this is how we're going to police the world, or at least our nation. And so the shortcomings are every much our own responsibility as they are other participants. The thing that I think is so important, and Art let it roll off his tongue and didn't pause long enough, it is leadership. In those communities across the nation where you have seen good political police leadership standing up, acknowledging the issues and the problems, and then dealing with them in front of and transparent to the community, and oftentimes with the community, we have seen much better results than those who do not. And so when your officers, right, I used to always struggle with, well, morale's up, morale's down. Well, it just depends on your perspective and where you're sitting in the police department. And so when you start talking about that, it is more about who's in charge and who's making sure that you are cared for, that your family's cared for, that you're addressing, that you understand the bigger issue, as opposed to buying into the rhetoric and just letting your people go down the street without that support that is so important, not only for a police officer, but for every single one of us.
Jennifer, do you want to weigh in on that?
Yeah, I mean, I do think, budget cuts were coming due to COVID, I think, anyway. And for police agencies, I think when you talk about the defund police movement, or, some of the more rash decisions that have been made due to the George Floyd incident and the history there, but also because of COVID, I would just encourage people to take a thoughtful approach to those. I think, the idea of, and bring stakeholders to the table, the idea of cutting budgets and cutting police programs out of social situations where they are placed or have been placed for whatever reason, whether it was because there was a void that other social services weren't doing it, or it was causing crime in the community, or whatever. There needs to be a way to either prevent those root causes or to address them in place of the police services that are there. And I think that there is a large lack of understanding on the breadth and depth of those programs and the things that police officers and police agencies do that are, that may be better done, with other agencies, but just cutting the funding isn't the answer. It really needs to be a comprehensive, thoughtful process to figure out how to address the totality of those issues.
So going directly to the question of money and budget cuts right now, and this is for all of you. I'm going to pair my question with one that's here. What is being cut in this moment of having to have a whole other lines of funding for COVID issues in policing? What's being cut? in the moment? How much does it cost to police during COVID? What are the added costs? And then this question from, it says anonymous attendee, says, I've noticed a lot of police departments are dropping shot spotter technology due to budget cuts, and others are thinking of adding it due to an uptick in shooting in many major cities. I'd be interested to hear your thoughts on that technology in general, especially under tight budgets. So that's a lot, but if y'all would talk about money, added cost, what's being asked right now, what you're concerned about in terms of funding amid COVID, all of that.
Well, I can start. Because of the CARES Act funding, I think most departments this current year are going to do okay toward the end of the year. But at the end of the year, the CARES funding goes away. And we're going to be in a world of hurt. The economic impact of to our cities where we can't print money like the Congress can is going to be significant. And if anyone wants to talk about criminal justice reform, it's not cutting the budgets that's going to make policing better. It's having properly vetted, trained police officers that are not only initial training, but ongoing training with the proper equipment, oversight, policies and procedures, and accountability. And quite frankly, I think Chris can attest to this. In too many departments, the second you cut the budget, the first thing that goes by the wayside is training. And if you don't have the proper training, you're not going to have the proper outcomes, and too often, because people just won't get it done. And so I think we're just starting to see the beginning of the financial impact. And as we look at reinventing policing and putting together other systems in place to take to replace or complement a police response, that's going to cost money. And so unless the Congress gets their act together and starts working in a bipartisan way to move forward, and with the new administration coming in with the Biden-Harris administration, but if we see in a divided Congress, if we see nothing but partisanship, we're going to be in a world of hurt. Not only will we not reinvent policing, not only will we not be able to start new processes, I think that we're going to go back in time as it relates to the job that we're all doing for the American people, and I think we're in deep trouble. And the other thing I will say is all these cities are saying they're cutting $150 million to defund the police. They're doing that because they want to make people that believe that we should spend less in money, less in policing. They're really trying to appease that sentiment, when in fact they're doing it because they don't have the money anyway, and it had really nothing to do with defunding the police. It's had to do with the fiscal reality that those cities are facing, whether it's New York or LA. Here in Houston, we're lucky. We're going to cut all 5 academy classes because of the economic impact to date, and because of CARES funding, we were able to restore them. But next year, I think we're in deep trouble.
But before we go on, Chief, this added question is from Terry Collins of the Huffington Post. He says, are you at all concerned these many months into COVID about having adequate PPE? And in what particular ways have you had to reshuffle your budget to cover COVID-related costs?
Well, let me just say, the Houston Police Department is the city of Houston is the only city in the state of Texas that had to deal with the revenue cap. And so our city for many years now has had a structural deficit every single year to the tune of $150 million a year. So in 20 years, we've never grown as a department. We have the same number of officers today that we had 20 years ago, but 500,000 more residents. Imagine adding a brand new big city to a department to serve with no officers. Then on the same time, they cut our civilian support staffing by 53%. So this is nothing new to us. We've been fortunate that as it relates to PPE, the current administration was extremely slow out of the chute. I mean, we kept pressuring the White House to invoke the act, the Defense Production Act, to get us to PPEs. So it took months of to get, oh my goodness, we got a killer cat here on the loose, Katti. I love cats. I'm a cat guy. So to be able to get our supply up and running, we're doing pretty well as it relates to the PPE and the supply. And we've been able to recover our costs because of the CARES Act funding. But again, that's all running out in 22 days. And without congressional action, we are going to be in a world of hurt in terms of everything we do, including supplies and PPEs and everything else. And I told you I was going to give you an update. Remember, I told you that in May, during Memorial Weekend, they reopened the state, and we had done really well. We had maybe 36 officers have been exposed. As of today, we have, as of this morning, 159 employees, officers, 139 officers, 139, and 20 civilians in quarantine. So 159 are in quarantine, with 114 already come back positive, and 45 pending. To date, we've had 610 employees, 560 officers, and 50 civilians that actually got COVID and have returned to work. 3 have died, 2 civilian, 1 sworn, and 16 have come back. But the total that have been exposed and come back positive since we started this whole COVID is 724.
And your workforce is how large? Civilian and
about 5,300 sworn and 1,000 non-sworn. So you're looking at about it goes from 6,300 to 6,400 depending on where we're at between retirements. And I can tell you, we've already frozen hiring for the rest. We've already frozen hiring because we know that starting 1/1/2021. We're really going to be in dire straits here in Houston and across the country.
Jen and Chris, the landscape nationally, what's what, who's faring well, who's suffering, what's the money look like, what's the PPE look like, all of that.
I'll start. I mean, I do think, we've heard from the field that this is one area where the community has really stepped up. And I'll give some props to the nonprofit field as well in filling those gaps and identifying ways to assist with providing PPE, whether it be through identifying channels where they could get it and not having to fight, as Chief Acevedo said, waiting for the federal government to assist. So quickly getting them what they needed. And now a lot of them have really kind of changed or at least planned for the future and have ordered ahead for PPE. So they're prepared in that way. With regard to the budget, I mean, again, I think what we see in generally when budgets are cut, as the chief said, training, some of those ancillary positions that we don't realize are so important. The PIO roles, I know in the beginning there were a lot of PIOs being cut. Those are critical to community and police relationships and being able to get them the right information at the right time. Some of those efforts like the homeless outreach projects, units, those are the ones that a lot of times end up getting cut first. And so I think in the future, as budgets continue to be a challenge, those are areas to be thoughtful as well.
So budgets and how police agencies are dealing with them are all over the map throughout the country. And I think when we talk about this notion of defunding, right, there needs to be a responsibility around what are we funding in the first place and what is the success of that. And so what you find is there are jurisdictions that irresponsibly cut programs as identified, homeless outreach programs, things that have some significant impact on the community, but they continue to do business as far as arrests and those types of things in the exact same vein. When we know things like low-level narcotics arrests are not producing the results, the desired outcome that we want. And so why are we not, or we should be identifying those services that we can reduce, right? The biggest expense in any police department is, and it's usually somewhere around 90%, 85, 90%, is personnel costs. And things like, again, low-level narcotics arrest, traffic enforcement, these things that we've always said, yes, that makes our community safer. But scientifically, when you evaluate, does that provide the outcome that we want or the desired results, the change in behavior? Oftentimes the answer is no. But we continue to fund and support those programs over other things that we know work better or are more effective or efficient. So that's the discussion that needs to take place. And then PPE falls right in line with that, especially given a pandemic. That's probably at your top of the list, keeping your officers safe and working, not necessarily doing some of the things that we have historically said, oh yeah, that's policing.
Thank you. This question is.
Can I add a little bit? I'm sorry. I just wanted to add a little bit and push back a little bit and say, I think we touched on this before, but this year and the changes that have had to happen, I think are ripe for study with regard to exactly what we're talking about. And I think Chris alluded to that. But in the first 3 quarters of the year, Perfin and Major City Chiefs did a survey of about 200 agencies, and they found homicides and aggravated assaults up in those places. So violent crime is up generally across the country. And so, you know, looking at that data along with the changes that have happened in policing over this year, I think is an important step to understanding, because I'm not saying that we have any clear idea as to why those numbers are up. My guess is it's a culmination of a lot of things. But you know, looking at, there have been a lot of changes that have happened. And so it's an opportunity to see if decreasing proactive policing has had any impact on our crime rates. And, you know, we were sort of forced to do it. And now is an opportunity to take a look at that.
Well, and so one of the things, right, and not when we look at statistics, right, most of those statistics are drawn from year over year. Sometimes they're month over month. That is not an indicator. Let's look at a trend line over the last 20 years, right? Then you start to see what is the true impact of this. Is crime really up or down, right? Or is it just the natural flow of what goes on in our society? Because a few years ago when the economy went bad and we saw fewer police officers in 1 year over another, 40,000 fewer police officers working than the year before, and crime went down dramatically, including violent crime. So those are the types of things that, again, I always caution, and I'm certainly not a data scientist, but I work with lots of them, right? We need to look longer term as to what's going on as far as the trend line goes, as opposed to this year over year, aha, look, this moment in time, because you have what is called an exogenous shock to the system that we're going to have to evaluate statistics for this last year with a big asterisk that says, yeah, we don't know for sure. And so I would really be cautious about saying, oh, crime's up or crime's down, right? I mean, I think we need a longer look at that.
The next question is from Grayson Danger. He's with Forbes. He asks, or he says, the NYP halted its crisis intervention team training for officers dealing with mental health calls in September. It also, just as an aside, has a pilot project in 2 neighborhoods where mental health clinicians are handling, you know, their front line for mental health calls. So there's those 2 things. So the question is Houston under budget pressures to eliminate that kind of training? And is that kind of training also being eliminated elsewhere in the country in this COVID moment where trying to keep people out of jails and prisons who have mental health issues is also a priority?
Yeah, I think this is Art in Houston. I mean, well, first of all, mental health training is mandated by state, by statute in most states, including here in Texas. There's the minimum standards that have to be met. And there's continuing education requirements in terms of mental health. And we
for crisis intervention teams specifically?
For the teams, or is that crisis intervention training?
For the teams, not for the police officers.
We're going to continue with our crisis intervention teams, and we're going to continue to try to expand them as much as possible. You talked about the clinicians responding. We have a co-response model here that is phenomenal, where it's a police officer that's extensively trained in crisis intervention, along with a civilian counterpart that's a clinician. And we are actually doing clinicians at our communications center where no one responds, because we can use that clinician to actually at the 911 center when people are in crisis calling in, we can deal with it over the phone, connect them with services, and actually de-escalate these situations. So we're not going to get rid of our crisis intervention teams or training. And what we're trying to do now is expand our co-response teams, because unfortunately we only have, I think it's 8 teams for 50,000 calls a year. That doesn't cut it. So what we want to do is have enough teams so we can have 4 teams on in the 677 square mile city, 24 hours a day, 365 days a year, because to date, those teams have yet to have a deadly force encounter with a community member. And that's something that's why we're a learning site for the Department of Justice, the Bureau of Justice Assistance, on our response and mental health division, how we respond to people in crisis. We just have to expand it.
Are those teams remaining intact elsewhere in the country, or are there cuts in those areas?
I think that most communities, there would be tremendous pushback if the communities learn that one of the most critical, assets that we have are being cut. So I'm not aware of too many departments cutting where those teams exist. As a matter of fact, I'm learning more and more and hearing more and more of departments actually creating teams, either co-response teams where they haven't existed, or looking at a model where unarmed clinicians respond outside of law enforcement. And a lot of them are starting to follow our model where we're actually at the call center, and people that call up and are in crisis are being connected to clinicians right there at the 911 call center, and these incidents are being de-escalated and mitigated without any response, and it's actually working very effectively.
Jen, Chris?
Yeah, I mean, I can give some anecdotal information. I know we're working with the Tampa Police Department in Tampa, Florida, to assist with revising their CIT, their training, but also as a precursor to moving into a co-responder team approach as well. So, and I know, the mayor has made that, has made it clear that addressing issues of mental health is a priority in the city, and certainly for the police department.
Chris, you're going to pass on that one? You can. We have more
questions. Yeah, they covered it well.
Okay. So I actually wanted talking about mental health of officers, as the chief was getting into. What's happening right now? Is there any data collection around PTSD, depression, anxiety, etc.? And second to that, how is it changing the workforce? Are people retiring early? Are fewer people enlisting? What's going on?
I can talk a little bit about the suicide numbers. I think there's 159 to date in 2020. So with regard to officer suicide, there was 239 last year and 182 the year before. I think what we have to remember is that this is a very new program with regard to collecting data on officer suicides, and as a result of mental health issues. So I'm not entirely sure how accurate that is with regard to how often they're reported, and whether or not every suicide that is related to an officer is captured. I don't have anything with regard to PTSD or mental health issues, other than, there are a lot of organizations looking to assist in that area and provide services as much as possible.
I'm going to move to the next. Chris, were you going to? Okay. All right. So there is a question here, and it's about sort of racial disparities and the profile of the demographics of who's being arrested now, and the extent to which that has or hasn't changed under COVID. And that's a question from Aaron Morrison from the Associated Press. Anybody? I mean, part of that is a sort of jail pretrial arraignment question, but is there any data at all just on arrests right now?
Is this on people being held, racial disparity on who's on personal bond, who's let out?
Yes.
Well, I mean, I think COVID or no COVID, that's part of the national conversation on cash bail and the disparate impact it has on communities of color and poor communities, including poor white people. It's rather than having a system that is making decisions on bail or no bail or letting people out, rather than making it based on cash, it should be based on a risk assessment. What is the risk of this person? What kind of public safety risk? What risk do they pose to the community from violence? Or what is the risk of reoffending, or what is the risk of us absconding? I think most of us in law enforcement recognize that cash bail has been disproportionately impacted and been discriminatory against disproportionately communities of color and poor communities, including poor white communities. And so, fortunately, here in Harris County, we've already entered into reform as it relates to misdemeanor bail, and so there are very few people. I mean, just a handful, really, that are in jail for misdemeanors in our city. There are some carve-outs, like DWI is one of them. Domestic violence is another one. But very few people are behind bars, and we support that. Now, I think Jen was talking a little bit about, are we seeing 1 year, and Chris is right, 1 year is not a trend. But if you go back 2 years now, I think we're going to see that in the last 2 years, we're starting to show some trends in recidivism where it seems to start be going up a little bit. We're seeing a lot of people that were taking the misdemeanor bail reform concept and maybe treating violent people that are charged with violent crimes and have a history of convictions for violence that are going in one door and out the other. And so I think we're going to have, Chris, a conversation and take a look at how that's impacting communities, including the communities of color that sadly are victims of violent crime, are disproportionate communities of color and poor white communities. So there is this disproportionality. We recognize it, and we are committed, I think most of us in law enforcement, to moving our criminal justice system to a more just path.
Sure. And I have Chris, I'm sorry, go on.
Oh, I was just going to add one quick thing to say that part of the problem when you look statistically at this information, right, you have police department house data, you have jailhouse data, and you have court information. Very rarely is that combined to look holistically at what is the outcome and how does that circle around and play back into, right, are arrests being dismissed, how are they being adjudicated? And so that's where, tremendous focus could be placed in order to really evaluate when we start talking about the bail system and everything else. There's disparity, we know in that, but how does that disparity or change in the system then impact the front end when police officers start dealing with people?
Chris, I'm going to react to that because one of my, when we testified to the Senate and to the House on reform and the importance after George Floyd's death, law enforcement component of the system is probably the most transparent as it relates to data. I mean, most police departments, we share our data. I think you're looking at our data now and a lot of the things we're doing. But who doesn't share data very well? Prosecutors and courts. So if we're really going to address a system that has been a disparate system that has impacted communities of color, we've got to make sure that every single part of that system is being transparent. And I think as we move forward talking about reform and criminal justice reform and restorative justice, that members of the legislatures across the country and the Congress require the courts and the prosecutors and even defense groups like public defenders and offices to see who are they, if you're a public defender, who are they fighting for hardest, you know? So there's a lot of data out there, and I think that right now, a lot of the data is missing. I'm not sure it's not by design, by other parts of the system.
Steve, I see you there, but I have one final, because I want them to whip around. I was really taken by the firefighters in Houston, making sure that occupancy under COVID is not exceeded. Would each of you, as you sort of give us a final word and tell the journalists what you think ought to be covered, if there is a redesigned system coming out of COVID, what might that be? Start with you, Chris.
Wow, so I'll give you pie in the sky. A redesigned system evaluates everything that the police agency does, who they're introducing into the system, how that impacts the loop that Art just spoke of, and that we start to evaluate policing based on, does it produce the outcomes that we desire? Does it actually keep communities safer? Does it reduce crime? Or is it just a fallacy? I mean, we, in the 90s, arrested people at a higher rate than ever in the history of the world, incarcerated more people, and yet violent crime and crime in general was at all-time highs. And so we need to do something different. And if that comes of COVID, it would come at a very high cost, especially to those individuals that have lost family members. But boy, that would be significant.
Jen?
Yeah, I mean, I think somebody said it in the beginning of the panel that this is an opportunity for us to look at the changes that were made to see which ones may work into the going forward. For example, you know, virtual responses, police responses to limit community, you know, touch points with police. So I would just, again, urge that it be a very thoughtful, comprehensive, total solution that takes, which talk about pie in the sky, which takes into consideration all of the various stakeholders and their positions, and doesn't give an opportunity for, you know, those pieces of the criminal justice system or social service systems to sort of fly under the radar and be the cog in the wheel that's not able to, you know, where they're causing challenges, you know, down the line that come to a head in the policing world. And just make sure that we're taking all of those pieces into consideration and that they're evidence-based and well thought out.
Chief, what's good about coming out of COVID? What's going to be different?
I think that what we need to look at is how we respond in terms of the way we did business, and take a really look at what impact it had, and to see how many of those strategies we can continue forward. Like the people we weren't booking for certain crimes, is that something we should probably look to see if that didn't have a negative impact or a positive impact? Maybe that should be a long-term strategy. And so, again, I think this has been an opportunity, just like a lot of businesses are realizing you don't need to have as much office space potentially, and your workforce is probably as productive, if not more productive, when they're working from home. I think this will give us an opportunity to take all of our lessons learned and apply them beyond COVID-19. But unfortunately, I have to go because I'm supposed to be on another call with my counsel, and you know, those are the bosses.
Yes, thank you, Chief.
Thank you so much. Thank you.
And thanks all of you, in fact, for all your time. I'm sure we'll have other questions for you that we'll send you by email that you can answer from our participants. But we're already about 10 minutes late now, but I think this was a well worth it to hear these really fascinating ideas, and we'll continue exploring these, I think, in future webinars. I mean, I think COVID has positioned us to really think hard, not only about policing, the future of policing, but about corrections. So again, thank you all very much for your time. And we will now take a 10-minute break.
Thank
Thank
you.
you.
Thanks.
Bye.